Hello, my name is Kayla, and on behalf of our team, I would like to thank you for allowing me to share our work looking at geographic disparities among gynecological oncology patients at the Huntsman Cancer Institute. HCI is an NCI comprehensive cancer center serving 5 predominantly rural states and the largest geographic area of any comprehensive cancer center at 17% of the U.S. landmass. The PIs for this project are Professor Deanna Kepka and Dr. Catherine Harris. This research is a small part of our larger ULTRA study with the overarching goal to identify factors for future interventions which impact the care trajectory of gynecological oncology patients. ULTRA stands for Understanding Limitations to Rural Access. In looking at geographical barriers of access to healthcare, there are several measures available, and we only examined a handful. The United States Department of Agriculture Rural Urban Commuting Area Codes, or RUCA codes, are designed for use at the census tract level and determine codes based on population density, urbanization, and daily commuting patterns. The Rural Urban Continuum Codes are subdivisions of the Office of Management and Budget's metro and non metro categories. They are designed to be used at the county level. These codes range from 1 to 9, increasing with degree of rurality, and codes 4 through 9 are often considered rural. A code of 4 indicates a county with a population of 20,000 or more and adjacency to a metro area. Geographic health provider shortage areas are federally designated and designed for analysis at the county level. These describe areas disadvantaged by shortages in service and not population density. We also looked at driving distance from residents to HCI. It has been shown that increasing distance from health services inhibits the use of primary and secondary care and is associated with a range of poor health outcomes, including lower than expected 5-year survival from cancer. We conducted a survey and chart review of gynecological oncology patients seen at HCI during May 2020 through March 2021. Differences in time from diagnosis to first gynecological oncologist visit and postponement of medical appointments due to COVID-19 were compared between self-report recall and chart review and by geographic measures. We had addresses which were geocoded in ArcGIS and examined at the census tract level, zip code level, and at the county level. RUCA codes were examined at both the zip code and at the address level and then associated with census tract codes. Distances employed a 200-mile threshold, and penalized logistic regression tested differences adjusted for age and insurance and was performed using SAS. In looking at the demographics of the participants, the ages range the ages ranged from 23 to 85, averaged 56 years, and was skewed toward the older ages. Just over 95% had some form of insurance, and due to oversampling, a little over 30% lived in non-metro or rural areas of less than 20,000 inhabitants in a county. After controlling for age and insurance, patients in health provider shortage areas had 78% less odds of medical appointment postponement or cancellation due to COVID-19. Only residents in a primary care health provider shortage area tended towards significance for longer times of 3 weeks or more to see an oncologist, with crude estimates significant at 90%. Odds for time disagreement between recall and chart review was 3.3 times greater for rural patients and was significant at 90% after adjustments. Gynecological cancer patients in primary health care in primary care health provider shortage areas were less likely to miss or postpone medical appointments due to COVID-19. Those in rural areas may recall time to see an oncologist differently than urban residents, while health provider shortage area residents may actually experience longer wait times to see an oncologist. Our results suggest that careful consideration should be given to selecting exposure measures for geographic disadvantage, and that geographically tailored interventions are needed for both urban and rural gynecological cancer patients throughout the Mountain West to address geographic disadvantage in gynecological oncology care. Thank you so much for your time today. Please feel free to send us an email if you have any comments, questions, or suggestions.